we're going to turn it over into what I want to do is introduce this world of data breach, loss of patient health information. And Scott is going to talk to you about some of the changes to the HIPAA laws, specifically the HITECH legislation, which Sean will also touch on, which really sort of changes this whole world of how you deal with patient health information. So with that, I'll let Scott. Do you want this? What do you want?
This is where I kind of get excited. How many of you guys are the compliance officer in your medical practice? Could you tell me? So the compliance officers out there know that you've got some new exposures and some new challenges. As I look at what happened with the new HITECH Act, which came to us through ARA, the American Reinvestment and Recovery Act, I'm kind of reminded of that saying that we all can remember when the CMS people would come into your office back when it was DHHS. You know, I'm here from DHHS, I'm here to do an audit, I'm here to help you. So anytime the government says, I'm going to help you, you kind of get that chuckle effect. What's going on with all this? Under HITECH, we have new enforcement, we have new penalties, we have some new exposures that we've got to be very aware of. And I'm just going to drill down as we look at this data. This is I'm from the government, I'm here to help you data. Let's drill down and take a look at what it means for you. First of all, fines and penalties for data breaches, the loss or disclosure of personal health information are much more severe under the HITECH Act. I'll talk to you about some of those actual numbers here in just a minute. In order to remediate, the procedures are much more onerous. They can involve many steps, which can be very expensive. And also, negligent compliance practices can result in fines up to $1.5 million under the Act. How are you guys at risk? What can you expect your exposures to look like? What about lost or stolen records that include personal health information? Those can be paper records, flash drives, they can be disks, laptops even being lost. I was approached by a medical practice a few days ago. We faxed mammogram information to the patient's work fax number. They sent us a sheet of paper with the number we were supposed to fax this to. We accidentally faxed it to the other number on that sheet of paper, which was their work fax number, and it sat there for 3 days. We know we've got a breach here of that patient's PHI. What do we do? And this can be very, very common. Records management. Sometimes our safety systems are just not adequate. I'm reminded of a practice in Arkansas I worked with many years ago. I got a phone call from the physician after I'd done a risk assessment in his practice, and I mentioned to him that the small room back behind his practice building, he had a small building back there full of medical records. I said, this is really not the kind of security that you need to think about for your medical records. Arkansas, as you guys know, is very prone to tornadoes. They've had a lot of those this year. He calls me and he says, I think I've had a data breach. A tornado picked up my building and spread it across 3 counties. And my records are now out in these woods and fields and things. He actually organized a Boy Scout troop to go out and collect his medical records. It was kind of the best you can do. These things happen. What about disgruntled employees? Is this an issue or a problem for you? Have you ever had a disgruntled employee leave your practice and something's missing as a result of their departure? I've seen it happen many, many times, and if that information is PHI, it could be a very, very big problem. Hackers are an issue. I don't know how you guys feel about it, but I'm not worried about the computers taking over the world because my computer can't tell the difference between junk email and good email. They haven't gotten that smart yet. But you can expect hackers are very intelligent and they're very smart, and for some reason they're very into getting into our data, and we have a lot of issues there. Business associate issues. We may have ineffective BA processes or insufficient. We'll talk more about that in a moment. And what about segregation of duties? A medical practice that I worked with was telling me the story of the staff member who went in to check on the health status of their aunt. Well, their aunt had not allowed them to have access to their medical records, so they're in there checking on that. And while they're in the medical records room checking on their aunt, they're going to check on a couple of their friends as well and see what's going on with them. So these kinds of things also do happen and can occur. What's amazing is that most times when a breach occurs, we as practice administrators are not aware that it's occurred until well after the event, until well after the breach has occurred, and that's a big problem and something we're going to have a struggle with as these new rules become more and more onerous. Let's talk about the interim final ruling for breach notification. They issued guidance back in 2009. The final interim rule was issued again in 2009, and it became effective for breaches that occurred after that date. But as you'll see from this chart at the bottom here, from enforcement aspects, the penalties have become much more onerous for breaches that occur after that 2009 date. Take a look at the boxes on the far right there. You'll see that penalties now range from $100 to $50,000 per violation. That's per breach of documents. And a violation can be the disclosure of 10, 12, 100, 500, 1,000, 2,000 medical record documents. Then the calendar year cap is 1.5 million. They've given us a nice upside to our risk. We know that we're only going to have to pay 1.5 million per year. I'm sure we should be very grateful for that. But the issue is that you've got a big dollar exposure out there. What about electronic medical records? What about the transition to EMR? I began working with EMR, believe it or not, back in the early 1990s. As a practice administrator, we were trying to come up with a way to develop an electronic medical record system. At that point in time, the technology was so far behind what it is now. Our solution was to have a computer terminal in each exam room and a scribe that followed the physician, who basically entered data as the physician was conducting their exam. And we also scanned medical records documents and other materials into these optical jukeboxes. Do you guys remember those? They had CDs, and you could film everything onto these CDs. They had these arms that would reach out and grab the CD and put it on. It took forever for these things to cycle back and give you the data you wanted. But it was a sort of fledgling EMR process. Today, there are more than 3,000 vendors selling electronic medical record products in the United States. And some of them are obviously very good, and some of them are probably not so good, and some of them may go by the wayside. But all of those, as you think about electronic medical records, and you know you will have to think about EMR, EMRs are going to increase your chances for losing PHI. Your PHI are going to be in more places. You have new technical, physical, and administrative safeguards you have to work with. You have to follow the HIPAA privacy rules very stringently. And when we talk about health information, the definitions are exceptionally broad. Any information in any medium whatsoever that is created or received by a healthcare provider, and that definition is huge, schools, universities, healthcare clearinghouses, insurers, and relates to past, present, or future physical or mental health or condition of a patient. That's codified under 45 Code of Federal Regulations, Section 160, paragraph 103, if you want to take a look at the specific regulation. And as you take your handouts away with you, I would encourage you to keep that. And I always used to like to highlight some of that data, because the internet search systems have become so sophisticated now. We're literally able to log in, plug in that specific site, and it will take you directly to that law or regulation if you want to see for yourself exactly what is said, exactly what is stated there. So that's actually a very good thing to have in terms of some of the sites. We've got some good references for you here. Sean's going to talk about high-tech in your practice. What do you need to do in your medical practice to make sure that you're geared up and ready for high-tech? And in just a little while, I'll talk more about EMR and also talk about business associates as we roll forward with this. So, Sean, I think you're it.
Thank you.